So, Dr. Bilski, we've been talking about dental implants, on how the process, the cost, and all that. Right now, we're talking about what should we expect after the procedure?
So that's a good question. Everybody, the three major questions are, how long is it going to take? How much does it cost? How's it going to hurt?
You hurt?
Yep.
Yeah, okay.
Right. So typically, almost all of the time, there's always somebody that you can't get numb or there's an infection, which we wouldn't put an implant in. But maybe we thought we were going to, but it's clearly not working. So we would probably, the term is abort the procedure. But in most cases, it does not hurt during the procedure. When you're done, they're probably most of the time are stitches, sutures. We typically, we feel you're going to have soft tissue swelling, meaning the gum or the cheek, because we have to stretch you a little bit. That's the procedure. We would maybe use a prednisone, an anti-inflammatory. Sometimes we give you a shot in the arm. Sometimes if you're under IV sedation, we put the anti-inflammatory steroid, corticosteroid it's called. Then we're going to have you take Tylenol and Advil in combination, which is on our website. I know Dan put that on. It's a little like cartoon, and it shows you like take 4, then 2, then 4, then 2, then 4. And it's a quick explainer video. But basically just start with 3 or 4 Advil, wait 4 hours and 2 extra strength Tylenol. And you keep alternating that throughout your 2 to 3 days with your ice pack.
Really? Yeah.
And you should be okay. Now, here's the kicker. I don't know what you're going to do once I put that last stitch in and send you on your way. I've had people light up a cigarette waiting for their ride right on my front step.
Not good?
Not a good idea. You shouldn't drink through a straw. It creates a suction, a negative pressure. It pulls your stuff out.
Okay.
All right? Not the implant, but messes up the gum tissue. When the gum tissue gets messed up, that's the pain. You eat on that side. Don't eat on that side. So we always say, quick one, no Cinco de Mayo. Nothing hot, spicy hot, nothing fizzy, nothing crunchy, nothing alcoholic. So covers that. No straws, no sippy lid covers from Starbucks.
Okay, yeah.
Chew on the other side.
Chew on the other side.
And or follow the instructions that we recommend. Take your medications. And we have these exercise fanatics. Now, you look like you're pretty good shape.
I got to get back to the gym.
I got to go to that gym. Like, hey, Randy, you want to see me like a couple days after I just done this because you're in pain? Yeah. How about why don't you just go for a walk? Why don't you take it easy? Why don't you just eat on the other side? Because your body had trauma. So it's your body is fixing it itself. Yeah. Let it work. So typically, it's what to expect. You're going to be achy. You're going to be sore. We can't do anything about swelling. Your body will swell if it swells. Most of the time, if you think about it, bone doesn't have nerve endings. Now, it may have a nerve running through it, but it doesn't have nerve endings.
Right.
Your gum has blood vessels, lymphatics,
all sorts of stuff.
Nerves.
Yeah.
So when we use a blade or we take a tooth out, it's the fibers of the gum tissue that are being disturbed, injured, traumatized. That's why when we talk about stuff that we do in our practice with the laser dentistry, it cauterizes. It's not really like Star Wars where, I take a limb. No. But it does cauterize the lymphatics, the nerve endings, and the circulation in there. So we get a clean incision. It maintains that blood flow. Pretty neat. So when we close up the tissue, put a stitch in, it's, no pun intended, it seems full. It's not seamless. It works together. It's pretty good.
That's pretty neat. Yeah. Pretty neat. Hey, we're doing a whole bunch of videos just about dental implants. So if you're not on the website, bilskidental.com, why don't you head there right now? We'll see you in the next one.
Look forward.